Hi, I'm Matson. I'm a student at the University of Washington School of Medicine. For the last month, I lived in Lander and spent time at the hospital and some of the local clinics. Besides being struck by the beauty of this small town, unfortunately, I was also struck by the number of pregnant teens I encountered. Fremont County leads the state in teen birth rates and at 69 pregnancies per 1,000 teen females, which is over 3 times the national average. This is no insignificant figure. A number of other problems arise that are associated with high teen birth rates. Teenagers who have children are less likely to graduate from high school. In fact, half of teenage mothers don't graduate from high school. And having a kid while you're still a teen also predisposes the baby to birth complications and an increased risk of being raised in an impoverished or single parent household. I'm making this video to talk to you about safe sex in hopes of reducing teen pregnancies. Going hand in hand with preventing pregnancy is reducing the rates of sexually transmitted infections, or STIs. Fremont County is over 6 times the national average for STIs. The trend in popular culture is to glorify teen pregnancy, but the reality is that being a teen parent limits your future options, reduces the chances of high school graduation, and increases the chances a child will be raised in poverty and have birth complications. Give yourself a chance to be a kid before you have a kid. There will be plenty of time to have a family after graduating high school, finding a job, and saving up enough money to raise it. The good news is that preventing unwanted pregnancy is not that difficult. The most powerful weapon in doing so is knowledge on what does and doesn't work. Before telling you about the various types of birth control, I wanted to talk about some common myths and misconceptions surrounding sexual health. First is that it only takes once having vaginal intercourse to become pregnant, and that includes the first time you have sex. A female can also get pregnant if she has sex during her period. Also, withdrawing or pulling out isn't a very effective means of preventing pregnancy. It only takes a small amount of semen to impregnate a female, and this provides absolutely no protection against sexually transmitted infections. So that takes care of some of the myths of sexual health, but what does work? Well, there's only one method of birth control that is 100% effective in avoiding pregnancy and sexually transmitted infections, and that's abstinence, or not having sex. Abstinence doesn't only apply to virgins either. Saying no is always an option, whether you've said yes in the past or not. There's some other benefits to abstinence as well. Sex doesn't only lead to pregnancy, but it can also change the dynamic and feelings associated with the relationship. Even if you have sex with someone, there's no guarantee they're going to stay in the relationship with you. The same is true if you have a child with someone. That doesn't mean you two are going to stay together. You've probably heard it before, but it's true. Sex complicates things. The easiest way to keep a relationship simple and keep yourself safe from STIs or pregnancy is to not have sexual intercourse. Now, abstinence isn't for everyone. Studies have shown that almost half of America's teens are sexually active. There is an acceptable alternative, though. If you're going to have sex, use some sort of contraceptive to reduce your chances of becoming pregnant, and use a condom to avoid STIs, including HIV and AIDS. The next type of birth control I'm going to discuss with you is one of the easiest, cheapest, and most widely used, and that's condoms. They're among a class of birth control called barrier methods, which also includes a female condom, a diaphragm, and a contraceptive known as the sponge. I won't cover these here, but if you want more information on them, I'll provide some websites at the end of this video and links in the video description where more information is available. Latex condoms can be purchased at convenience stores, supermarkets, drugstores, or even vending machines in some public restrooms. Their cost is typically less than $1 per condom, and many family planning clinics offer free or low-cost condoms. Condoms are very effective at preventing the transmission of STDs and pregnancy. However, this is only if they are used correctly and every time. If you or your partner are allergic to latex, condoms are also made in other materials, which are available at most stores. There's no age restrictions on when you can buy condoms either. Whether you're 12 or 80, the store can't stop you from purchasing them because of your age. And no need to be embarrassed about buying condoms. You're making the smarter choice in preventing you or your partner from getting pregnant. And if you think carrying a condom with you is going to ruin the mood, imagine what a pregnancy will do to it. There's a variety of other birth control options that must be obtained from a physician. A number of medical practices offer birth control services. This includes family doctors, general practitioners, pediatricians if you're under 18, an obstetrician gynecologist, or OBGYN, and general practitioners. In addition to this, women's health and family planning clinics specialize in the control of sexual health issues, including birth control. A common option that many females use are hormonal-based birth control pills. A common misconception is that they can make females sterile, but this is not true. However, some STIs can lead to sterility. These pills contain either a combination of estrogen and progestin, or progestin only for females who can't take estrogen. You take the pill once a day, every day, and the hormones keep your ovaries from releasing eggs. These are 99% effective. However, that's only if you take them absolutely every day. This option doesn't protect against STIs, so dual protection, or taking the pill and wearing a condom, is recommended to give protection against both pregnancy and disease. The next option, available through healthcare providers, is a class of contraceptives known as long-acting reversible contraception. The best part about these is you don't have to remember to do something every day for them to be effective. You get them put in, have protection for extended period of time, whether you remember it's there or not. This class of contraceptive includes what's called an intrauterine device, or IUD, an injection, or a subdermal implant. There are two types of IUDs, hormone and non-hormone. These are inserted by a physician into a female's uterus and offer protection for 5 to 12 years, depending on which type you get. They can be removed whenever you please. These are a bit more expensive, but are usually covered by insurance and Medicare. The injection is a shot of hormone that provides protection for 3 months. The subdermal implant is a small rod inserted under the skin of the upper arm and is effective for 3 years. These long-acting reversible contraceptives are very good at preventing unwanted pregnancies, with a greater than 99% success rate. However, these do not protect against STIs, so dual protection with condoms is recommended. The last option I'll discuss with you is what's called emergency contraception, or the morning after pill. This should never be relied on as a primary form of pregnancy prevention, but sometimes life happens and it's good to know your options. Should you forget a pill or have a condom break, this is a safe and effective alternative. For men or women 17 and older, you can get it without a prescription. If you're under 17, you can get a prescription from your healthcare provider for it. It costs between $10 and $70, usually closer to the more expensive figure, and must be obtained from a pharmacy or drugstore. It is important to understand that this isn't an abortion pill, and as it's been labeled in some of the media. In the case a pregnancy has already occurred, this will not prevent or end it. It's made from the same hormone found in birth control pills, progestin, and works by preventing the ovary from releasing an egg. It can be taken for up to 120 hours, or 5 days, after unprotected sex. However, the sooner it's started, the more effective it is. It's 89% effective at preventing pregnancy if taken within 72 hours or 3 days of unprotected sex. Emergency contraception doesn't protect against STIs. For any type of birth control, the most important thing to remember is that you have to use it every time you have sex, exactly as the instructions say, to benefit from the treatment's contraceptive effects. Dual protection, or using condoms plus either hormonal methods or long-lasting reversible contraception, is very effective and protects against both pregnancies and STIs. This has been a relatively brief overview of some common types of contraceptives. The subject of sexual health is a mile wide and a mile deep, but it is my hope that you now have enough information to begin making informed decisions. It is important you have somebody you feel comfortable with to talk to about safe sex. Knowledgeable resources include your doctor or other health care provider, or your parents. Additionally, there's a good number of resources online that give accurate information. You have to be careful finding information online, however. Make certain your information is from a reliable source. Some good sources include bedsider.org, an online birth control support network operated by the National Ad Campaign to prevent teen and unplanned pregnancy. They provide a great overview of birth control methods, including proper use, cost, effectiveness, and where to obtain them. Another one offered by the National Ad Campaign to prevent teen and unplanned pregnancy is stayteen.org. Their goal is to encourage you to enjoy your teen years and avoid the responsibilities that come with too early pregnancy and parenting. They provide information on safe sex, relationships, dating, waiting, and contraception. PlannedParenthood.org is another good resource, devoted to improving women's health and safety, preventing unintended pregnancies, and advancing the right and ability of individuals to make informed and responsible choices. They offer information on birth control, emergency contraception, pregnancy, STDs, and abortion. TeenSource.org is another good website. It's a California-based online resource aimed at improving the health and well-being of young people by providing non-judgmental, accurate, and reliable sexual and reproductive health information and resources. They offer information on contraceptives and teen rights and privacy regarding reproductive health. Additionally, some community resources, including your physician or other healthcare provider, are good to contact. Fremont County Family Planning is an important resource to keep in mind. There's both a Lander and Riverton location, and they are a safe resource for acquiring more information on pregnancy prevention. Their phone numbers are listed in the video description, as well as links to the websites I mentioned. Teen pregnancy is an issue in Fremont County, but an avoidable outcome for teens if they have the education and knowledge necessary to make conscientious sexual health decisions. The fault of teen pregnancy doesn't fall all in the hands of teens either. Healthcare providers, schools, and parents all need to be talking openly to teens to give them the knowledge they need to live the lives they want and have children when they're ready. Thanks for listening.